Another problem that we deal with in our patients is snoring and sleep apnea, which are two really separate conditions but associated. Snoring is basically sound being created while we're sleeping, and the sound is being created by air passing through a narrow passageway in the back of our mouth and our throat, often because our jaw alignment is off and the tongue posture is off, as well as the soft palate is very steep and draping at a steep angle, so it creates a very narrow passage between the tongue and the soft palate, and that creates noise, almost like a reed instrument, like a clarinet. The sleep apnea is what occurs to the person during the night when they're sleeping because their airway may be constricted. And this often is occurring because of a jaw misalignment, where because of proper development, the jaw hasn't developed a more forward posture in relation to the rest of the body. So when we look at the throat, we'll see that the air passage between the back of the tongue and the lining of the throat can be so narrow. It's almost the size of a cocktail straw. It's so narrow, where normal airway is going to be much wider. So in the patient with sleep apnea, when they're laying down, because their muscles tend to lose some tone at night, their throat will collapse even more, creating occasional restrictions of the air passage. So what happens is they go to sleep, they're breathing, the airway narrows, it gets constricted, they're not able to breathe. So the brain gets stimulated and arouses them, keeps them from staying in a deep sleep. And oftentimes this can happen multiple times an hour. It can happen 50, 100 times an hour for someone with a severe sleep apneic problem. The result of sleep apnea is that the oxygen levels to the brain are impaired. So immediately it starts to cause an impact on brain health. And because it's stressing the brain, it also will cause a shift in the hormonal balance of the body, often increasing the level of stress hormones and contributing to other health problems. We know that it can contribute to diabetes. It contributes to cardiovascular stress. Also contributes to degeneration of the brain over time. So in the presence of other problems we've seen relating to dentistry, like inflammation in the body and the mouth, contributing to inflammation in the brain, or toxins introduced to the body through dental treatment like mercury, in the presence with sleep apnea, this is like a triple whammy, causing real compromise to the health of the brain. So we treat the problems by evaluating the jaw misalignment, designing an appliance to be worn at night that helps to keep the jaw in a forward position that opens up the airway and maintains proper passage of air at night while they're sleeping.